welcome to White Swan Foundation's webinar on workplace mental health. We've spent the past couple of years doing a lot of work on mental health at the workplace. And today's topic is about talking to your manager about your mental health, or what if you are a manager who wants to talk to your team about mental health in general and make your workplace a more mental health friendly space. To have this discussion, we have two very important guests today with us. One is Dr. Aditi Raghuram, who is an industrial and organizational psychologist. She comes from the Steinbeis IEC University in Germany. And we also have with us Deepa, who's a mental health advocate. Deepa has had experience working in capacity as HR in different organizations, but she'll also be talking about her own experience of mental health issues at the workplace and the different thoughts that she's had over the years and where she's arrived at right now. So I'm just going to dive right in before we go into statistics about how mental health is prevalent at workplaces, and start with Aditi on the entire concept of, the one person that we speak to the most at the workplace is our manager outside of our colleagues. So why is this relationship one that needs a great level of clarity? And why should anyone consider talking to their manager about their workplace at all? What are the pros and cons of doing this?
So your manager is basically the one that is directly related to your workload. They are the ones that give you feedback. They're the ones that also evaluate your performance. And your manager is basically your first point of contact with any sort of designing that you can do related to your workload or any other types of your job, the type of role you have, what jobs, what work you're doing, when you work, etc. Is your manager is the one responsible for all of this. And the conversation with the manager has to happen not in terms of, I need to share my personal details with my manager, but in terms of how can my manager help me thrive regardless of my mental health issue. How can I thrive at work? And that's why your manager needs to know. Having said that, your manager does not need to know the details of your personal situation as much as they need to know what makes you tick, how can you thrive, what are the conditions you need for you to be able to work despite your whatever condition you have.
What are the pros and cons of, as in, I get what you're saying when when you mean that this is the one person who structures your work day, your perhaps to the extent of your tryst with the organization, your career. But there are pros and cons of doing this, of having this open dialogue with the manager. What are the pros and cons?
Well, best case scenario, you get all the support that you need.
Yeah.
And you thrive at work, and it's a win-win for everybody. They get the best of you, you get the best of them, and you have enough time to take care of your your family, yourself, your health, everything. That is the best case scenario, which of course is not what majority of the people experience. The worst case scenario obviously is that you can have a very unsupportive colleagues, you can have a very unsupportive manager. Worst case scenario, you get fired because they don't understand that you can work despite whatever you're going through. In some situations, that may not be the worst case scenario because you probably don't want to work for them anyway. But having said that, I think the cons can also be very subtle. Something you cannot really measure or detect or complain to somebody about. It could be in subtle treatment, or the way they talk to you could change. They could talk to you in a derogatory manner, or maybe subconsciously they could think that you are weak and that you are unable to do certain things, so they don't give you the responsibility, etc. So there's definitely cons to talking about this at work, but the pros are also not negligible. You definitely
Right.
can feel more comfortable, feel more safe when people
Mm-hmm.
know what you're going through. It's very difficult to go through whatever it is alone, right?
Mm-hmm.
Having to pretend to be somebody else is a very
Yeah.
difficult process, which probably worsens your condition as you
Mm.
go along as well. So
Mm.
there's definitely two sides to the story, and I would say, depending on your context, which you have to assess,
Right.
figure out what that context is, who are the people around you that you can talk to, and who are the people around you that you absolutely should not talk to, because the reality is that there are people who you should not talk to about this.
Right. Right.
Um,
A lot of people have asked us is that most organizations, especially the larger organizations, corporates in India, have now taken to having employee assistance programs and counselors on board. So when there is the provision to talk about my mental health with a counselor or an EAP, what really is the benefit of having my manager being in the know? Or should I just keep this between me and the employee assistance program counselors?
So, to the extent that your manager is, you are accountable to your manager, and your manager is responsible for your work day, your hours, do you get to work from home? Is that
Mm,
a decision that your manager makes for you? So, if
right.
that's the case, then they need to know only as much as is related to the job, right?
Mm,
So,
mm,
they don't need to know personal details like what happened to you, why it happened, what treatment are you taking, are you seeing a therapist. This is not something that is
yeah.
relevant to them at all. But what they do need to know is what can you do and what is something you cannot do.
Mm-hmm.
What is the
Yeah.
environment you need, or what are the time restrictions you have.
Mm,
Is your workload too much for you to handle?
mm,
uh, Break up your tasks into little pieces. Can you do maybe something once a week instead of doing it every day for the week?
yeah.
So these types of things, they're unrelated to your HR, to your counselor, your manager is
Yeah.
directly involved in this.
Right.
So this is the only scope of why you talk to your manager about it.
For a lot of people, since the manager is the one person that your reporting manager may quite often be the cause of stress, which at the very base level is the mental health issue that most people are familiar with. Sometimes with an existing mental health issue could be the trigger leading you to become more vulnerable to the mental health issue.
Yeah.
So then what do you do? As in, what is a person's options in that? In case talking to them may or may not be an option. What are your thoughts on that?
So again, it's very context dependent.
Yeah.
Uh, if it is something that directly related to what your manager is doing, there are ways to have this conversation without bringing the manager into focus. Like, you are the cause for my problems is not the best way to approach this. So you
Yeah.
have to frame how you are talking to your manager in a very fact-based, very situation-based type of thing, and take the personal feelings you have about your manager out of the situation. So instead of saying, you are causing all these problems, you are giving me so much work, therefore I have
Mm,
all this stress, instead of that, you can say, my workload is far too much for me to handle.
mm,
Is there a way we can figure out how to reassign this, or maybe split it up into tasks, that
mm,
are smaller, etc. So that way you're taking the blame out of this situation. Of course, the manager knows that it is they who are giving you this
causing it.
workload, right? So the message has been passed, but you are not directly accusing them of being insensitive, or
Yeah.
overworking you, or whatever it is. So it's very important to use the right language when you
Mm-hmm.
speak to your manager.
Yeah.
Um, just like you also want to be spoken to with the same kind of respect. It's a two-way street. So
Right.
try to bring the emotions and the personal negativity, if you have any, are outside of that conversation.
my question will be that when you're talking to your manager, is there a way to assess if this is a safe space in the absence of the organization establishing that talking about mental health is acceptable?
Mhm.
For the individual, are there signs that you can look out for to say, I think my manager is going to get it, and I have a sense that if I talk about my mental health, it's going to be okay?
This is a complex question to answer,
Yeah.
because I think as an individual you have a certain sense of what your manager is like.
Hmm.
Um, Maybe there are conversations you can bring up that are very general and completely unrelated to you.
Mm-hmm.
Like, Deepika Padukone has talked about depression.
Yeah.
And what do you think of that? What do
Yeah.
you think about this whole mental health issue being made public and so on and so forth? And when you talk about general, unrelated to you topics that are around this mental health issues,
Mm-hmm.
um, you get a sense of what they think. You get a sense of
Yeah.
whether they're sympathetic towards this person, or do they understand that this is important, or do they shut this conversation down by saying, oh, this is all just stupid, she's just doing it for publicity, she's weak, or whatever,
Yeah.
something.
Yeah.
You get a sense of whether or not you feel safe. I think it's really dependent on the individual. The question to ask really is not, how do I know, what are the signs in the other person? I think the question to ask is, do you feel safe
Mm.
enough to
Right.
trust this person enough to have this conversation with them?
Mm.
And I think that is something every individual already knows if they have enough interaction with their manager.
Right. Right.
In cases where they don't really see the manager very much, they don't have the interaction with them, they cannot judge or assess, then it's basically by chance, right? You start
Mm.
talking about, you can say, somebody has this issue, or bring up a general conversation and
Yeah.
get a sense of where they stand. And
Mm-hmm.
then you can decide how to proceed.
Is there a way to structure your conversation with your manager? How much do you share? How do you decide what you need to share? And what does a manager really need to know about in the event of a diagnosis? That's one part of the spectrum. But oftentimes, a lot of us need to talk to our managers about our general mental health. So, what kind of information does a manager really need to work with? How much should you share? What's the right recipe?
So I'm a firm believer that it's on a need to know basis, right?
Mm,
What do they need to know to help?
mm,
That's all they need to know, right?
yeah.
So as long as it's work related, so whatever is related to your environment, to the time that you spend working, to your workload, to what you're responsible for, your deliverables, etc.
Mm, mm,
To that extent, you do have to share this information so that you can have a better working relationship with them. You can have a better working relationship with yourself.
yeah.
Uh, but your manager does not need to know what happened all through your childhood, or how you were, how your condition developed over time, or any of the other personal or emotional details around it. And they are not equipped for that anyway. That's
Mm,
not job to understand or listen. So that's not something that you have to share at all. All they need to know is, what is this doing to your work behavior, and how
mm-hmm.
can you address those issues objectively.
And does the concept of confidentiality come in at all? Can you expect confidentiality when you're talking to your manager?
Ideally, you should
Yes.
be able to, but
Yeah.
we all know that's not how it works, right?
Right.
So, and you're not protected by the law either.
Yeah.
So, I mean, I would say go by trust yourself
Right.
to know how much to share.
Hmm.
And uh, I am a skeptic. I always go from, you need to earn my trust and then we'll see kind of a thing. So I
Yeah.
wouldn't go and put everything out there. I'd
Right.
be very careful and say, share only as much as they need to know as far as possible.
Right.
Confidentiality, you cannot really expect. I would say you can't really expect it unless it is required by your company or by law to say you cannot share medical information with other people, etc.
Yeah.
So be very careful when you're
Yeah.
doing it.
Absolutely. I think just to add to that, that it may be useful to look at your company's policies. Ask what the policies are. You may work in a multinational company that may well have a policy on confidentiality. So if you are one of those lucky people, then maybe you should check that out. The other thing is that by the law of India, the Mental Health Care Act, discrimination on the basis of mental illness is against the law. But then, it doesn't really play out on a daily basis. Implementation is not has not yet taken place. But by the law, discrimination by mental illness is not okay. But it may help to look at your internal company policies. Is our understanding of it as of now? Is that something that we can go by, Aditi?
I think so, but I think it's also important to define what discrimination means. So
Means,
is it
yeah.
me, is it when I make fun of you or if I talk to other people about you, is that discrimination? Or is it I'm not giving you projects or I'm not giving you promotion? Is
Mm-hmm.
that discrimination? So I think the nuances really have to be uh, discussed, fleshed out. What is this discrimination? So I think that's a separate conversation. You have to really understand what this law states and what your rights are.
Right. Coming to the point about talking to your teammates, as in, so that's also, it's not just managers, but it's also how you are presenting yourself in your team that matters to most of us. How do you then decide whether you want to be out as a person with a mental health issue in your team?
I would give you the same answer that I did for your manager. Trust yourself, trust your instinct, know whether you trust these people or not.
Hmm.
Have general conversations about these topics and feel them out.
Mm-hmm.
See what their thoughts are. And often, when you speak to somebody in a group, they give answers that are socially desirable that may not be
Yeah.
really what they're thinking. So I
Yeah.
think maybe take each one aside and have these conversations individually with them.
Right.
Right? Negativity spreads much faster in a group than
Hmm.
positivity. So, for example, if you have
Hmm.
four people who are positive and one
Yeah.
person who is negative that goes in, the other four become negative. But then the
Hmm.
reverse is not true. So if you have
Right.
four negative people and one positive person goes
Yeah.
in, they do not change their attitudes, right?
Right.
So it's always the negativity that spreads faster. And
Right.
in a group situation, it's amplified.
Right.
So I would say talk to each person individually,
Hmm.
um, see how they feel about it on an individual level. Do not have these discussions in groups with people. It's not going to help you at all.
Would you agree with me when I say that, Aditi, when we say that the organization should know how to respond to these, say, emergencies in some cases?
Yeah, that's absolutely, absolutely true. So that is a need to know
Mm.
situation, right?
Yeah, yeah,
So yeah, so if you are at risk for any sort of uh, episode, like Deepa said, then I
yeah,
think it's important that people know how to respond to it.
yeah.
What should they do? What should they not do? Also, not just what should they do, because something else could trigger, a reaction. So yes, absolutely, that definitely comes underneath to know this.
What if your manager has no idea about mental health, and then does it then become the job, and if the organization has had no training, does it then become the job of the person with the mental illness to inform them? Speaking on behalf of those with mental health issues, this can be a tiring process. But then, what are the ways out? So, how do you deal with this? Educating your team and your manager about mental health.
I don't think it's so much educating them about mental health as it is educating them about your needs. So it's not your responsibility to teach them about all mental health issues or how to respond or how to develop empathy or whatsoever. But it is in your best interest to educate them about what you need. Right. So to that extent, I think I wouldn't call it education so much. I would say advocating for yourself. Right. So I think it's important that you understand for yourself what your needs are. A lot of us don't know, we haven't spent the time to figure it out. So if you're working with a therapist, I would say maybe have that conversation there and try to work with your therapist to figure out what will make you thrive at work. What conditions do you need to be able to work efficiently? And if you're not working with a therapist, then maybe examine your own reactions to different types of situations and look at what conditions make you thrive. So, for example, this is just an example from my own observations about my working style. I have to do some very deep brain work, read something very intense, grade papers. I'm an academic as well, so if I have to grade student papers or if I have to grade a thesis, that's something I prefer to do the first thing in the morning because my brain is sharp, it is active. I haven't been bogged down by the other needs of the day. Post lunch, there's no way I can do this work, right? So I have to really structure my day in a way that says, okay, I'm going to do all this administrative, busy work that doesn't require me to think too much. Right. When my energy levels are fading. But on my good days or mornings or sunny days or whatever it is that makes you tick. So that is something you have to know for yourself to be able to share or to ask for that accommodation. So I would say the first step in that is then identifying your own working style, your conditions. Do you learn better by reading or by having a discussion with someone? These are simple things for everybody, not just for people who have mental health issues, but for everyone. And more so if you're trying to get accommodation. So you be your best advocate.
Right. And oftentimes, especially if you work in a smaller organization, a lot of these accommodations are not very difficult to make, to say, can I do this kind of work at this time of the day and then do the less focus-oriented work in the second half, or one of the other requests that we've had in our own organization is to say, can I sit in a quieter place where there aren't too many people milling around, and most managers, from my understanding, will be able to make these accommodations.
Absolutely, yes, right? But it's important that you ask.
From the manager's perspective, and I think you've answered this when we asked, what information should I share with my manager? But from the manager's perspective, do you think it helps to do, what kind of questions should they ask in terms of knowing the diagnosis? Should the manager do some reading up? What is expected out of the manager in this exchange?
It depends on how much the manager already knows, who's already informed, right? So there's a lot less work to do when the manager is already informed. But going in, if they have no idea, I would say the first place to start is tell me what you need. I don't. So it's also important for the manager to show this vulnerability, to say, look, I don't know what you need, and I'm happy to learn about this. But can you help me get started somewhere, because I have no idea. So putting that vulnerability out will also soften the expectations from the side of the employee when you say, okay, fine, at least this person is trying, right? As opposed to, I'm not interested, or, okay, fine, just tell me what you want, I'll see what I can do. That's a different tone altogether. And so I think sort of meet halfway, both people meet halfway, and both show empathy for one another. That's very important.
In terms of, I think this is the big question that every time we go into workplaces, talking about workplace mental health across the board, leadership, managers, everyone asks us these questions. What about deliverables, right? I have a set of things that I need to do, and how do I then, I think there are two parts to this question. One is the big question, what about my deliverables? Like, what do I do if I'm busy giving everyone accommodation? And let's say we get past this question, then what the next question then becomes, how do I then negotiate deliverables, keeping in mind the person's mental health issues?
Right. I think accountability is very important.
Yeah.
So you say, okay, these are the deliverables. And when the employees say, here's what I can do, here's what I cannot do, or, I will give it to you by this time, or this is the deadline I can work with. I think it's important that you stick with that, or, if you cannot, obviously, sometimes you cannot stick with whatever it is. So there's that little bit of wiggle room that you need as well. But overall, I would say accountability is important in some form, right? So, the managers are also responsible and accountable to, other people who are above them. And so that's where the pressure is coming from. So they experience the same pressures that you're experiencing. And going back to my previous point again, empathy all around. Everyone has to have a little bit of understanding for the other person and try to do their best in that scenario. But without clear accountability and clear deliverables, often there's all this murkiness about what is my role really? What is my role? I have a lot of people I talk to, they're like, yeah, I'm an HR business partner, but they're pouring coffee, and then they're also developing these training programs for to tech whatever. So there's not really a clear role definition, right? So that has to also come into the picture. Now this is your role, this is what you're responsible for, here are your deliverables. How can you meet them?
Right.
And then the employee says, well, here's what I can do, here's what I cannot do. And you say both sides have to remain accountable to that.
Right. In which case, I think the next question then becomes, in terms of giving feedback, in terms of deliverables not being met, how does the manager ensure that they're giving feedback in the right way, by making sure that they're including empathy in the feedback, but at the same time, everyone is there at the workplace to work?
Absolutely. So again, I go back to what I said earlier about keeping it job related. I think often we overlap the whole personal attacks with keeping it performance related or job related. I think you have to separate the two, especially in this situation. You have to be very careful that you're not accusing the employee of being irresponsible or taking advantage or whatsoever, right? You talk about, okay, I see that you haven't really met these deliverables, and this has been happening for a while. So let's talk about what's really happening here. Why have these things not been met? And is there something we can do so you can meet these things in the future?
Right.
So the conversation has to be less personal, less accusatory, less judging, attacking, and it has to be really more about the work itself.
A common question that we get from managers themselves is to say that this seems to be a little over and above my job description. To say, one question that we get a lot is that I'm not a counselor, as in I don't understand this, and we do responsing. You don't have to be a counselor, but I think to some extent the fear of having to extend yourself emotionally at the workplace is something that managers seem to not be very comfortable
with. I laugh because I think basic empathy is being confused with therapy. And I think that they have to understand that therapy or counseling is completely different from an empathetic ear.
Yeah.
Right. To the extent that you say, okay, so I see that you are suffering. I'm happy to help you with any job related things that I can do.
Yeah.
But beyond that, it's out of scope, of my ability to help you. So then I would say to the employee as well, things that are not related to your job, that are related to your mental health, do not have to be discussed, right? Or to your needs while you are at work.
Right.
Those, you don't have to discuss those things.
Right.
So really, it depends on both individuals, how much empathy or what kind of relationship do you have with your manager. You go out and you go drinking every weekend with your manager, then by all means figure out how much you want to share, how much the manager wants to be a therapist or a counselor. Please don't do that. But how much you want to listen and be a good friend is really up to you. How much of emotional investment you want to have in this is entirely. But my recommendation always is to keep the cathartic conversations, emotional conversations out of the workplace.
Right. I think there's one person who says that I am comfortable talking to my manager, who seems to be a perfectly nice person. But the response that I get when I talk about my mental health is, we all experience this, and this is what is called adulting, and you have to focus on delivery. So I think this sounds a little bit of a dismissal of some sort. But also not completely understanding what the person is going through. So how do you then respond to this? This doesn't necessarily mean that the person does not understand or does not want to understand, but a small dismissal.
I don't think it's helpful in this situation to judge, to say, oh, they don't understand. It could be because maybe they're also stretched so thin that they don't have the room to give you that. But that comment is dismissing for sure.
Yes.
That is, minimizing the experience that the person is going through and saying this is adulting. No, it's not. Adulting is something completely different, right?
Right.
So,
right. Absolutely. Yeah.
You can have mental health issues and be a completely, fully adulting human being.
Yeah. Yeah.
And no, that's not okay. That's not acceptable. At that point, you probably want to really have a sit down and talk to this person, especially if she or he is saying that they're quite understanding.
Right.
Then this is something that you have to talk about. Or if you feel like, I don't want to talk about my mental health issues anymore because I feel shut down, then just talk about what you can and cannot do. Keep it work related.
The next question is, I shared some mental health issues with my manager, but this was used in my appraisal and rating, and I feel like I have no support. So clearly this person has gone the length and had this conversation, but found that things backfired. Is there a way out of this situation?
Again, it depends on the people. It depends on whether you're able to consistently perform to show that it has nothing to do with your performance. So I would say keep a record of your performance, of the things that you're doing. Make sure that you are able to prove that your work is absolutely unaffected by your condition. So that way nothing can be held against you.
Right. So the next question is, what if the person what if the manager does not know that you have a mental health issue? Is there a way for the organization to recognize that there is no system in place? If
I'm
there is
sorry,
no system in place.
can
So is
you?
there a way for the organization, is there a way for the manager to be educated and look out for signs in the workplace if the person has not shared that they have a mental health issue? I think this is more a question on, how do I as a manager know if someone in my team has mental health issues?
Um, so these are very difficult questions. I mean, a mental health professional who's like a counselor or a therapist is probably
Mm,
better to answer this question, because um, it different conditions manifest very differently in
mm,
people. You know,
yeah.
a set of siblings can both share the same condition, say depression,
Mm,
and it will look completely different in both people.
yeah.
So I would say, just in general, though, if you see drastic changes in behavior that catches your eye, then maybe have a
Mm,
conversation with the employee and say, is there something I can do, or is there something going on? And leave it to them to share how much they want to
right.
share.
Right.
But beyond that, I don't think you should try or say, what's happening, tell me, um, or you look depressed.
Mm.
That's definitely not an approach to take. I've been noticing that you seem a little off lately. Is there something going on? Would you like to talk, or something like that would be more comfortable for both.
We have one question from Omita Jain, who asks, what if you don't get any help from your organization? In that, what can be done? If in an individual capacity, what is it that can be done if there is absolutely no hope of getting help from your organization?
That's a very tough situation to be in. So I'm sorry,
Yeah.
people who are in that situation, because if you are privileged enough, you can say, okay, I'm done with this place, I'm going to move on and find something else to do. But a lot of people do not have it of saying, I'm going to quit my job. And then the onus really is on them to seek help outside the organization, uh, to get support outside the organization as far as possible. Um, Maybe rally support within the organization, people, your colleagues, people who you can trust, rally them together and have support groups and things like that. But yeah, it really just depends on the people around and what type of organization it is. It's a difficult situation.
Yeah, and I think that's sort of the reality for most people at this moment in India, given the status of how much mental health in general is recognized in organizations. I think I'd like to go into your own experience as an industrial psychologist, and you've had the chance to study organizations. And I think it'll be an interesting time to talk to managers about the benefits of having a mental health friendly workplace and a mental health friendly team. And I think that's something that we haven't, while we've spoken about the relationship between the manager and how the workplace can be a much better place, but just from a numbers perspective, is there a positive to having a workplace that's able to talk, that can possibly talk about mental health?
There's plenty of research out there to support the idea that, to put it in very simple words, a happy worker is a productive worker, right? So there's enough of research to support the idea that wellness is important.
Mm-hmm.
Uh, there are governments now that are investing heavily in workplace wellness, because we spend most of our lives at work,
Mm.
and what happens there affects how we function as human beings.
Mm.
So definitely better productivity, better engagement. You also have people who are more loyal and committed to the
Mm.
organization because they feel supported. Um, there's really no downside to it in the long term. If you're thinking about a sustainable workforce, there's
Mm,
really very little that can be said, okay, this is so people may say, well, cost is a factor. Yes, cost is
mm,
a factor right now.
mm,
But there are actually examples, there are case studies of organizations that have invested heavily in workplace wellness interventions that
mm,
over time have really seen the benefits of these investments. And not, when I say over time, not over 30 years or 40 years, but
mm,
as little as a year, 2 years, right?
mm,
Um, if you actually go to YouTube and you look for workplace wellness best practices,
mm,
you'll find all these videos about companies that have adopted very, very smart strategies
mm.
for their workplace. And
Yeah.
they tell you how it has really improved their productivity, their health, the
Mm,
creativity.
mm,
The creativity of their organization, of their teams,
mm.
has improved because they have focused on wellness.
Right.
So yeah, so it's definitely beneficial to everyone involved.
When we are saying that we want to talk about mental health at the workplace, this is not to say that anyone that a manager or an employee needs to be a mental health expert or or a counselor or solve the mental health issues of their teammates. It is simply to be able to make accommodations which are professional in terms of time, and also to see how you can help a person with a mental health issue function better at the workplace. Because I think a lot of the questions that we're getting right now is about, how do I do this if I'm not a counselor? And I think we're just getting several questions on on that vein. If you can just address that as well.
So you're not required to be a counselor. It is not your job. It is not your role.
Mm,
You have to send your employees to someone who can actually help them with their mental health issue.
mm.
Your role as a manager is to help them arrange their work in a way that does not aggravate the mental health issue. It's as simple as that,
Right.
right?
Perhaps we can talk a little bit about the need to escalate as well. And I think that's an important thing to say, that there are a lot of this is not, um, um, is not your specialization. And so there may be the necessity to escalate something.
Right, right. So yeah, at that point you have to seek, refer your employees to maybe HR in your organization is better equipped to tell them where they can go.
Mm,
Uh, so that is something they can do, is refer them to HR. It's not at all advisable to take this on as managers by yourself, right?
right.
Get the support of HR and do it that